This week, I'm back in the Civic and I'm joined by Dr. Debbie Chase, who is the Public Health Director at Southampton City Council. You've been sending in lots of questions during the COVID crisis, and I put those to Debbie to see how we can safely move forward together as a city. My first question, with the lockdown easing, is it safe to be out and about?
There are a handful of new cases of Covid-19 in Southampton every day now as a result of lockdown. So that's promising. We've reached a better point, but we're not living without risk, and therefore it's really important that we take precautions to reduce our risk further.
What are the top 3 precautions that we all need to be taking?
The top 3 precautions that we all need to take are: 1, if we have coronavirus, so we have the symptoms, we must isolate immediately, go to the NHS Test and Trace website for information, or call 111 to support. Equally, if we're in contact, then we must do the same. 2, frequent hand washing, so hand washing for 20 seconds or more, as frequently as possible, as we did prior to lockdown and have continued to, very important. And then thirdly, social distancing, really important to keep that distance as much as possible.
Why does 2 metres matter?
2 metres matters because the scientific evidence shows us that that has the least risk of spreading infection. As we come closer, that risk increases. And so if we want to reduce risk, we want to maintain that distance. But if that's not possible, for instance on public transport or within shops, it's important to use face coverings to give us a minimal increased risk of spread of infection.
How are you monitoring the rate of infection?
So we know from national media the R value is a way of monitoring infection, and before lockdown R was between 2 and 3. With an R value of 2, one person will infect 2, 4, 8, 16, that's the increase in cases. As a result of lockdown, R has gone under 1, which is really encouraging. So that means that for every one person infected, they'll infect one other or no other individuals. We know with the easing of measures, there's potential for R to increase. But at the same time, it's important that we look at infection rate, so the increasing numbers of individuals over time that have Covid-19, which we're tracking, alongside what we call early warning indicators, such as 111 calls. This gives us an idea of what's happening within our community and whether we need to take action quickly to reduce risk.
I hope that you found that useful. And thank you for sending in your questions, which I put to Dr. Debbie Chase. It's so important that you continue to check our website as the guidance changes and evolves. Our understanding of the disease continues to increase, and we want to make sure that you are keeping safe as well as your family.